to then refer to it afterwards. However, there are also other recordings on the HIS support site that you can access that might be a bit shorter. Cool. So without further ado, again, colleagues, welcome to the on-site EVDS training. The purpose of the training is to get you to become more familiar with the EVDS on-site interface. There we go. So today on the agenda, colleagues, it will primarily be, again, as we've covered the introduction and welcome, what we will do also, we'll go into an overview of what the EVDS is, providing you with an overview of the ecosystem and the various components, as well as your specific role in this ecosystem. And we'll also take you through the EVDS data flow. Throughout this first section, colleagues, will place a lot of emphasis on the role and component that is specific to you as the patient administrator and or vaccinator. And then we will have a system demo where Mabaya will be taking you through a walkthrough of the system for both the patient administrators and the vaccinators. And that will be a demo where she will be showing you how to interact with the interface itself. And then we will have a Q&A and quiz later on in the session, where we actually have a quiz that you can complete, a short quiz, 6 questions. It's not necessarily graded. More than anything, it is to measure your engagement with the material. And then we will take you through the user support package. And these would be material that you will receive or will have access to after this training that you can refer to in your own time. And we will also help you with some of the quick troubleshooting, looking at have you tried before logging a ticket on the HIS support site. And then also lastly, we will have another Google form for you to fill out, and that will be the training evaluation where you evaluate our training session so that we can improve it moving forward. So the main objectives for this session, colleagues, is to provide you with an overview of the EVDS and again demonstrate your role within this entire ecosystem. It is to also empower you with the skills and knowledge to confidently interact with the EVDS system, and so that you can actually perform your role and function quite well. It is to highlight then the support that you will be receiving again after this training to make sure that you can refer to it in your own time. Again, colleagues, could I please ask that everyone make sure that you are on mute? And then the fourth objective.
Ik het nou hierso dekend ingelog op by training.
I'm sorry, colleagues, could you please just make sure you are on mute? I think it shows up as
Ik kan ingaan op Teams. Teams is okay-ish. For now. But
there we go. Thank you. We will have a Q&A session, colleagues, as I had mentioned in the agenda earlier, where you can ask us any questions and we will do our best to address them. In the meantime, colleagues, if you do have any questions, you are free to pose those questions in the chat, and we will then address them in the chat box as well. And then also, lastly, it's to also get feedback from you regarding the training session, and also to see how you've engaged with this material that will be shared with you today. Colleagues, some of the ground rules before we get started, and before I even get to the ground rules, colleagues, I would then ask that could all the participants please in the chat box state your name, surname, email, and organization from which you come from. I am aware that some of the participants or colleagues of us are joining all from a single device. However, there are 4 or 5 people in the room. Please make sure that you mention all 4 or 5 of those individuals. So colleagues, when going through some of the ground rules here, we do understand that there are time constraints and that people do have other places to be at. So we will do our best to try and keep to the time that the session has been scheduled for. I think also another thing that's important to keep in mind is the respect throughout the entire session and maintaining decorum colleagues, is to make sure that when engaging with one another, we respect and listen to each other's views, questions and opinions, and some of our concerns as well. Regarding some of the virtual rules, colleagues, I think it's important to keep in mind to make sure that you are on mute at all times. This is to prevent any echo or noise disruptions. And then again, relating to questions, please feel free to ask any questions in the chat box. And we will also address them not only via the chat box, but also in the Q&A that's coming in later on in the session. And then some of the questions, colleagues, that we are unable to answer in this session, we will send a follow-up email where we then address those questions as well. And then regarding your participation, colleagues, we do understand that connectivity and work-related issues may arise. And that is why we had asked that you just make sure that you switch off your video to not consume too much bandwidth. But also throughout the session, colleagues, please do try and remain engaged and not to take any calls or check any emails or use any other apps on your devices. So we'll now go into what is the EVDS and providing you with an overview as well as the data flow of the EVDS. But before getting to that, I want to take us first through the balancing demands of the vaccine rollout that you would then require or should be kept in mind when executing this program. I think, colleagues, it's important to remember that given not only the COVID situation that we're in, but also understanding South Africa's social context, is that there are three levers that government continuously needs to balance when executing the vaccine rollout. And the first one being inventory control, which speaks to maintaining a centralized control of the vaccine inventory. And this is to make sure that vaccination sites are not necessarily hoarding dosages. And then the second one speaks to distribution equity, which speaks to actually making sure that the vaccines are distributed and administered equitably across various populations and demographics within the country. And then the last lever or balancing demand that needs to be balanced is the vaccination volume, which speaks to driving the highest throughput for vaccinations by closing the gap between the doses available and the doses administered. So in trying to balance all of these, there are various trade-offs that the government would make whenever pursuing any one or two of these levers. And the first one is, in the event where government is pursuing equitable distribution and inventory control, is that what you then find is actually pushing equitable distribution in South Africa is already a difficult task, understanding the discrepancy in the resources available to the various populations. And also this will then make it a lot more difficult for government to scale up their throughput across the country. However, when you are then pursuing the high volume and equitable distribution, this would actually require government to then, quote unquote, open the floodgates for the vaccinations. However, the trade-off there is that though you might be vaccinating a large amount of people, you then risk losing control or oversight of the inventory and tracking which vaccine is being administered where and to whom as well. And that will then lead to any other issues such as supply chain disruptions and everything again. And then lastly, the last trade-off is the high volume and inventory control. And this is quite important to keep in mind, in that whenever trying to keep a tight grips on the inventory while increasing throughput, this would actually eventually lead to vaccine supply being concentrated in densely populated or affluent areas. And the reason for that being that these are usually areas that are easily accessible and have a willing population, as well as the infrastructure to actually make the vaccine rollout program a bit easier. So I'll now take you through the electronic vaccination data system, what it is, its characteristics, as well as some of its core functions and benefits and its users. Again, specifically focusing on the ones that are important to you, which would be the EVDS on-site users. So I think, colleagues, it's important to keep in mind why we have the electronic vaccination data system, or EVDS for short. As mentioned here, the EVDS is actually aimed at trying to provide an authoritative registry to just track the various COVID-19 vaccination metrics towards controlling the pandemic. It's quite important to also note, colleagues, that this is kind of a one of a kind, or at least in South Africa, it's the first of its kind of an officially adopted centralized digital system that helps in governing and tracking vaccinations, right? It captures all the vaccination events occurring at the official vaccination sites, and then also makes use of data analytics through the built-in intelligence. And this will then help with monitoring and reporting any progress or any issues that might come up in the program. So I think the main users of the EVDS ecosystem, as we have them here, it's the vaccination site, scheduling administrator, congregate setting user, OHS user, the MFL facility representatives, MFL curator, MFL approver, MFL system administrator. And in this context, colleagues, MFL stands for master facility list. We then have the patient administrator, the vaccinator, account approver, account creator, and back capturer. I think for this session, colleagues, what's important are these green users, and then more specifically the patient administrator and the vaccinator, since that is the role that you will be performing. So the main functions of the EVDS here, colleagues, is that it helps in assigning vaccinees with a site, date, and time slot for vaccination for when they will be vaccinated. It also helps with capturing the data, such as your patient information, the safety information, where it helps with recording adverse events that might take place post the vaccination. It also captures the details of the vaccine site itself and records any progress, and also helps with reconciling payments between private sites or insured and uninsured individuals, and also helps with forecasting supply demand. And more importantly, it helps with standardizing the process, since there aren't any third-party workflows permitted within this entire program or in the EVDS. The main benefits actually help pertain to making sure that each and every single individual that does get vaccinated actually consents to receiving the vaccine. It also helps in driving efficiency and quality, and making sure that all liabilities are assessed in a timely fashion. It also makes sure that the vaccine is actually equitably accessible to the majority of the population. It helps with protecting private information or confidential information, and also provides an input into other systems such as the supply chain management and the NICD. It also then, again, through the data analytics, provides live monitoring of coverage, effectiveness, safety, and durability, and helps to streamline budget allocations and reduces the vaccine wastage. So what we have here on this slide, colleagues, is a high-level EVDS process, and this speaks to the process that would usually be followed from end to end by a general member of the public. So as you can see, the first step is that a member of the public would register to be vaccinated, and then that registration would actually be confirmed with an SMS notification supplying them with a vaccination code, a vaccination site, date, as well as a time for when they'll be vaccinated. This then feeds into the EVDS vaccine administration, which then where you will now find that the admin support confirms and updates using the patient's ID, their medical aid details, as well as the vaccinee demographic details as well. And then this individual will then be passed on to the vaccinator, who then completes a health questionnaire and obtains the vaccinee's digital consent to actually receiving the vaccine. And then the vaccine is actually administered, and this event is then recorded. In the event where the vaccine that is being administered to the vaccinee is a vaccine that requires 2 doses, a second dose will then be automatically scheduled as soon as the first dose has been captured. And also lastly, this then the EVDS will then link itself with the supply chain management, which informs demand forecasting as well as the supply of the vaccine stock to the various sites. So these are now, colleagues, what we have here are the EVDS component interfaces, and this speaks to the EVDS components, right? I will place specific focus on the on-site EVDS since that is the one that is specific to you. However, I do want to give you a high-level overview of the other components as well. So I quickly want to go through them. So as you can see here, the master facility list, which actually contains all the details of the vaccine site itself, and in the MFL, it pertains to select the facility selection, registration, curation and permit, approval, activation and deactivation. What the MFL component actually does, it pushes the site's detail or the facility's details into the data analytics components, right? So the facility details would be, things like its location, the operating hours as well. And these will then be pushed into the data analytics. This then feeds into the enrollment and scheduling component. As you can see here, the data analytics will feed it into the enrollment and scheduling, which speaks to the self-registration or assisted enrollment or system-generated scheduling. And what the enrollment and scheduling component does, it captures the demographics and booking details of the vaccinee themselves and pushes it into the data analytics component of EVDS. And then the most important component for this group or for this session is the on-site EVDS component, which speaks to verifying the demographic details of the vaccinee, capturing the health questionnaire, and also capturing the consent of the vaccinee, and then lastly, recording and or capturing the vaccination itself. As you can see, the main users here are the account creator for the specific site, which creates the patient administrator account, the vaccinator account, back capturing accounts, and also even creates other account approvers as well. And then we have the account approver account, which helps with approving all the accounts that have been created for that specific site. And then we have the patient administrator, which registers and verifies the vaccinee. And then we have the vaccinator, which administers and records consent as well as the vaccine. And then lastly, we have the back capturer the back capturer, which then captures the verification of the vaccination after the vaccination has taken place, and we will get more into depth as to what this role entails. But largely this component, as you can see, colleagues, is that it pulls data such as the facility details from the data analytics that it would have gotten from the MFL. It then also pushes the demographics and booking details of the vaccinee, right, into the data analytics. And these would then coincide with the ones that it would have gotten from the enrollment and scheduling component. And lastly, it also sends through the information related to the vaccination events and safety data. So on-site EVDS is where everything related to the vaccination process will then be recorded and then pushed back into the data analytics, which mainly just helps with the data management, governance, data quality, analytics, visualization, and data sharing amongst all these three components as well. So colleagues, you know, with a program, or rather with an interface or system of this size, it's quite normal or usual rather for there to be a broad stakeholder groups, and some of them that are included, at least for the EVDS here, are the likes of your vaccine manufacturers, the vaccine logistics providers, the vaccine funders, the regulators, and delivery partners, right? Understanding that this is not necessarily an exhaustive list, and also keeping in mind that this is a list that is constantly being updated as the program continues and reaches scale. So again, here, colleagues, as you can see, we have the EVDS components, the EVDS ecosystem, as well as its distinct components here. I want to particularly focus on the on-site EVDS component, looking at the users in this specific components, being the account creators, account approvers, patient administrator, the vaccinator, and the bag capturing administrator. I think colleagues do take note that as you see, the patient administrator, vaccinator, and bag capturing administrator all have an asterisk at the end. And what this means is that these three roles would actually be taking place, or these three individuals are physically at the vaccination site itself. So the patient administrator, vaccinator, and the bag capturer are physically at the site itself, where they are recording the vaccination of the vaccinee. So to take you through the EVDS ecosystem data workflow, colleagues, I think it's what this slide is trying to do is to just try and emphasize or clearly show the data flow between the different components, right? So if you will follow with me here, the master facility list captures and manages the approved vaccination site details and permitting status. So while the MFL is actually holding all the details of the vaccine site, it's also pushing those details into the enrollment and scheduling component as well. And this enrollment and scheduling component is primarily responsible for managing the vaccination enrollment through registration by self-registration, or using the different platforms, or assisted registration at the vaccination site, right? So these two components actually push data to one another. The enrollment and scheduling is taking information from the MFL as to making sure that it schedules individuals at the correct sites. And then the MFL is actually pushing its own data to the enrollment and scheduling regarding the details of the sites, but is also taking the data from the enrollment and scheduling component, looking at which individuals have been scheduled at the various sites. All of this information is then pushed into the on-site EVDS, which records the journey of the vaccinee who will receive the vaccine from a vaccinator, right, that is registered on the EVDS at an approved site and on a specific date and time, right? And I now want to go into some of the key dependencies that actually exist across the EVDS components. Is that vaccination sites, colleagues, need to be captured and approved before any form of enrollment and scheduling can occur at that specific site, right? And then on-site EVDS roles need to be linked to an MFL approved vaccination site, and that on-site EVDS makes use of the vaccinee registration details that it would have gotten from the enrollment and scheduling component. And again, lastly, the data analytics being the layer used for data storage and reporting. So to put it more precisely, colleagues, is that before a site can start having people being enrolled and scheduled to it, it actually needs to be approved as a vaccine site itself. So without the vaccine site, you cannot have people actually enrolling and scheduling to be vaccinated at that site, and therefore you cannot have any on-site EVDS that records the vaccination of that individual at a specific date and time. I now want to take you through the on-site EVDS data workflow, and this is more specific or more relevant to you as patient administrators and vaccinators or individuals who interact with the EVDS on-site system, because this is showing you the data workflow of the on-site EVDS itself. So what we have here is that the MFL database is captured and pulled into the on-site EVDS, where initially we will have an account creator create the accounts that are linked to, again, an MFL approved site. And these accounts would be the likes of your patient administrators, bag capturing administrators, account approvers and vaccinators, and all of them. You then have an account approver that actually approves all the accounts that the account creator has created. It's important to keep in mind, colleagues, that the same person that is an account creator cannot be the individual that also approves the account. And this is to serve more as a control measure to make sure that we do not have the same person creating and approving accounts for themselves, right? And then we have this then flows into your patient administrator, which actually then helps with verifying the registration details and as well as the vaccinee identity and appointment, and supports with assisted registration. It's important now here, colleagues, to keep in mind that this is where the on-site EVDS kind of intersects or meets with the enrollment and scheduling data, because the information that the patient administrator will be verifying here will be information that would have been pulled from the enrollment and scheduling data that would have been generated here. So this would be information such as the vaccination code, the date, the time, as well as the location of the vaccination. So once the patient administrator has verified the vaccinee's registration details, their identification, as well as their appointment, they will then hand that vaccinee over to the vaccinator, who will then again verify the vaccinee's details, their identification, as well as their appointment. And though this might seem like a repetition, this is more of a governance control to make sure that the correct individuals are in fact actually being vaccinated. So it serves as that second layer, if I can call it that, of defense, to make sure that the correct individuals are actually receiving the vaccine. The vaccinator will then capture the questionnaire, obtain the health questionnaire, obtain the consent from the vaccinee to be vaccinated, and then they will physically administer the vaccination. And then the vaccinator will capture this vaccine details on the system. Colleagues, it's very important that you keep in mind or follow this process, that when capturing the vaccine details on the system, that you only do this after the physical vaccination has in actual fact taken place. So only once you've physically given the vaccinee their jab can you then log the vaccine on the system itself. And then what then happens before it even gets to the last stage, colleagues, this is where the role of the bag capturing administrator then comes into play, where the bag capturing administrator can capture vaccination details. And again, these being their registration, the identification documents, the appointment details, and everything else. And then lastly, the post first dose now being administered, enrollment and scheduling system will trigger a second dose booking in the event that the vaccine that's being administered requires 2 doses. Colleagues, I think it's also important here to keep in mind, as you can see in the bottom left of your screen, is that not all sites will have a bag capturing administrator available to do the back capturing. So it is sometimes accepted that a vaccinator will also be performing the role of the back capturing administrator. So a back capturing administrator cannot do the work of the vaccinator, but the vaccinator can do the work of the back capturing administrator. And that is just to put it a bit more frankly or in a simple way. I think also now, colleagues, to just take you through some of the help contacts that you can actually access, or some of the things to keep in mind when doing your role on site, is to keep in mind that a Section 21A15 permit is actually required for a site to store any vaccines, all right? And then also when working on the EVDS on-site interface, to make sure that your device is actually recorded at the correct vaccination site. And when Mabaya takes you through the demo, she will show you exactly how you link your device to the facility. And also for vaccinators, only register the vaccination on EVDS after you have physically administered the vaccine to the vaccinee. You can access the EVDS using your Chrome web browser and going to this specific link. And then also the default password assigned to you on the creation of your account expires after 72 hours, meaning that once the account creator creates your account and you've been notified, you have 72 hours to go onto the EVDS interface, then create a new customized password and activate your account. And it's important to keep in mind, colleagues, that all your patient details are kept confidential and that the information used on the EVDS will actually be used to monitor vaccine uptake and coverage as well throughout the entire program. You can also access the user manuals on the EVDS by going to the help menu and then clicking on help, and it will then open up the EVDS user manual. If you do need help, colleagues, you can either email the service center or log a ticket on the HIS support site. And in the event that you do send an email, please do keep in mind that it usually takes 24 hours for the service center or for the service desk to respond. And on the system in of itself, colleagues, you only have access to functionalities that are required for your role, meaning that the patient administrator's functions on the system will differ from those of a vaccinator or an account creator. And then again, if you don't have internet connectivity or electricity, you can capture the vaccination on physical paper and then back capture on EVDS once internet or electricity has been restored. However, colleagues, best practice is that you actually capture the vaccine or the vaccination rather in real time on the system as well, and this is to minimize any human errors. And again, here are the contact details of the support lines. No need to write them down. We will be sending this pack to everyone after this training session. And then with the EVDS access control, colleagues, this speaks particularly to getting access to the EVDS, is that account creators and or the account approvers kind of need to be created, and then the account creator will start creating accounts for vaccinators, patient administrators, and everything else. What you will need is to fill out the access control form, which is also which would have to be accompanied by a letter of accountability for the account creator, as well as a certified copy of the ID for that specific account creator and account approvers. And then you will submit this to this email, hissupport@health.gov.za, with your subject line being account creator and account approver with super user functionality accounts, and then you will insert the province's name, the province in which you're operating, or the district name, or the private sector group name. So if you are a private sector site, you would then enter that instead of the instead of your province name or anything else, right? And then the stream lead will have to submit this email. So whoever your stream lead is, they are the ones that need to get the information for the account creators and account approvers, as well as their IDs, and then submit them. And then it's important to understand, colleagues, that you won't be granted access to the system or to the interface without the proper forms being completed and the supporting documents being submitted. So, colleagues, before we go into the demo, I just wanted to ask if there are any questions. Perhaps we can take 2 or 3 questions and then go into the demo.
I don't see any questions on the chat here.
Okay.
I have my hand raised. May I go?
Oh, yes, go ahead.
Hi, this is Ari, Business Services Division at Netcare. Just a question on the scheduling. As you'd appreciate, many private sector companies have their own internal systems and processes in place. My question is around the scheduling insofar as who determines the length of an appointment, firstly. Is there geo mapping that actually assigns patients to, well, geographically specifically located sites? And the third aspect is there a limit? So I am acutely aware that upon registration to become a registered vaccination facility, the facilities need to provide the DOH with vaccination times. So is there a maximum cap of patients that may be seen during the day, or is that also generated by the EVDS system?
Okay, I just want to make sure I understand your question, right? So you're asking, I think the one question was regarding the vaccines themselves, right? Sorry, could you please just repeat your question? I just want to make sure I understand.
Okay. Let's ask them one at a time. So the first question is, who determines which site a patient is allocated to? Is that based on the patient's geographic location and the nearest site, or is that a random pick and choose?
Yes, so that one, so once you've registered as a member of the general public, right, what the enrollment and scheduling system does, or component rather, what that does is it actually identifies a site either closest to you or the site with the fastest moving queue, and then allocates you to it. So it could happen that perhaps you and your siblings might be living under the same roof, and then you both register, but then one is allocated to a site either further away or one closer to another. So it's taking into account where the site is, but also where are you. And then relating to sites is that I think urban sites have a catchment area of 10 kilometers, 10-kilometer radius, and then rural sites have a catchment area of 30 kilometers.
Thank you. Is there a cap on the maximum number of patients seen? And is that linked, if so, is it linked to the, let's call it, vaccination times per site?
So when you're saying is there a cap on the amount of patients that you can see, you mean vaccine patients, right?
Yes, yes.
Not necessarily. What that will actually, that is impacted or differs from site to site. So if you were to see on the scheduling system, isn't it there are specific times or slots that are allocated there for when vaccines take place. So that is actually determined by the capacity that the scheduling administrator will put for that specific site on the system. So if you are putting that your capacity is to do 20 a day, then the system will try and allocate 20 people to you a day. You kind of determine your own cap, if I can put it like that.
Thank you. That answers that question. The last question was in relation to my first question. You mentioned something about patients or potential vaccinees living under one roof being assigned different sites. We know with patient behavior, oftentimes they could potentially just rock up at the site without an appointment. Is there going to be mitigation for that kind of risk, or are we just going to handle that on an ad hoc basis?
So that risk actually has been handled. So in the scheduling training, what they do is, and they also advise this, is that if for a site specifically, is that you would not necessarily put your site at 100% capacity. You would put it usually, especially if you're just starting out, for the first few weeks, you'd put it for like 80%. And that is to allow for walk-ins, like you had mentioned, where people might just walk in. So for example, I live close to a Netcare and a Netcare hospital, and I could just walk in there to get vaccinated. So they would change up their scheduling to maybe 80% to allow for people like me who might just walk in and then consume a vaccine, even though they weren't necessarily scheduled or even registered at the time when they arrive. So that is how they mitigate that risk. However, that in of itself also becomes a lot more dynamic as the weeks go along and more age cohorts come into play, and vaccine sites then start getting a clearer understanding of what the trends that they are experiencing in their specific location, and then adjust their scheduling.
Thank you.
Any other questions before we move into the demo? If there are any other questions, colleagues, perhaps you can raise them in the chat, and then I will address them in the chat as well. I will also tag you in the chat so that you get the notification that you've been mentioned, and then you can see that your question has been answered. I'll now hand over to Mapaya to take us through the demo. Over to you, Mapaya.
Okay. Thank you very much, Radley. Good afternoon, colleagues. My name is Mapaya Kumbane. I'll be taking you through to the demo. Allow me to share my screen. Do you have a view of my screen?
Yes, we do.
Okay. This is the EVDS demo. Please note that this is a training instance, ladies and gentlemen. The live instance that you're using might be different, and the functionalities on your live instance might also be different. And also please note that this device is not registered with any facility. This is what you'll get when you get to the facility for the first time. You'll have to register the device that you're working with the facility where you're working at. And as well as when you log in for the first time, or rather when you receive your login details for the first time, you'll have to change it to the login details that you'll remember. I mean, the password that you'll remember. To do that, you'll have to go to the login button and log in. Let's say you log in as an administrator. In case you forgot your password, you can use this button here. This will take you straight to the forgot password instance where you'll be able to change your password. And if you log in, then you'll click on log in. And if you want to change your password, ladies and gentlemen, you go under your login details, and then you go under edit profiles again. You'll get all your information there, and then down there, you'll have to change your password here, and then you'll update your password within 72 hours. So today we are not changing any passwords. We are just logging in. So as soon as you log in, you'll get into this page. This is where you'll have to link your device with the facility where you're working at. So you'll have to search for the facility. You'll put in the facility name here and you click on search. And there is another route to do that. You can just select the facility if you know where your facility is located. Let's say our facility is located in Gauteng, under region at the city of Joburg, and it's under region B, and the name of the facility is Helen Joseph. We like to use Helen Joseph because it's easy. And then you click on the facility when you get it, and then you set facility. After you've set the facility, you'll get this message. This message is to make sure that the facility way that you've chosen is correct and it's where you are located on that day. So you have to make sure that it is Helen Joseph, and it is in Gauteng. The district is Johannesburg, and the sub-district is sub-district B. And then after that, you can either change the facility if you want to choose a different facility, or you can just continue. After that, you must select a vaccine site. Remember, you have to select the facility as well as the vaccine site in order to continue, whether you are a patient administrator or a vaccinator. So let's choose our vaccination site. It's still Helen Joseph. You can find that other facilities have different or more than one vaccine sites. So Helen Joseph has only one vaccine site. So we set our vaccine site. You can notice that now the facility is now registered and the vaccine site is now registered as well. After this, you can now continue with your patient search. To search a patient, you can either search a patient here by using this button, or you can just click here in the middle of your screen to search for the patient. So let's search for our patient here. This will take you to this window where you can either search by appointment dates. If you know the people that came for that from that appointment, you can click on that appointment and you click on search. All the people that were set to come on the 5th of August 2021 will be listed here, all of them. And then you will choose the name of the patient that has come for vaccination on that day, and then you'll continue from there. But for today, let's search by using the number. So searching by the number, you can either use the ID number, the patient record number, or all other numbers. These are maybe your let's say it's non-South African citizens. They will have their numbers, other numbers other than the ID numbers or patient record numbers if they are not registered. So they will have maybe the asylum numbers or other numbers as well. So today we choose to search by the ID number. So we'll put the ID number and then you'll search. This will take you to the patient details. So let's put the ID number and then we click on search. After this, you'll get your search results down here. And then you'll have to confirm if this is indeed Julius. And then you also confirm the vaccination eligibility of the patient in front of you. And then after that, you can just click inside to get more of this patient. After you've clicked on the patient, this will give you the patient information. The patient full name, the date of birth, the gender, the ID number, the vaccine voucher will also be there. The physical address, the email address, the phone number that the patient is using, the medical aid. Please make sure that you confirm this information as a patient administrator. You confirm by asking the patient, or you ask for the identity from the patient, the identity document that they're bringing, whether they're bringing an ID or they're bringing a passport or they're bringing the driver's license. The information will be there. So you confirm the spelling as well for the patient's name and the surname. You also confirm their date of birth, whether it's correct. Is it the same as the one that is in front of you? The ID number as well. You confirm each and every digit of the ID number. You can remember that the patient have at most of the time they register themselves on the system, so mistakes are most likely to happen. So you must confirm all other information, even the physical addresses, the email. We can see that this patient doesn't have an email address registered. And also confirm the phone number if this phone number belongs to the patient. And the medical aid, we can see here that Julius, it says, doesn't have a medical aid. It may happen that Julius does have a medical aid, but during the time when he was registering on the system, he didn't mention that. And again, you can just confirm the vaccine eligibility. We can see that this patient is eligible for both vaccines. It means he hasn't been given either of the vaccine or any other dose of the vaccine. And then after you've confirmed all this information and you are satisfied, you can just click here on this button to say that you confirm that the patient information is correct and the vaccination number is as presented to you, and then you click. After clicking on this button, it will activate this patient detail information for you to confirm again and for you to make changes if you need to make changes. Let's click. And here you can see that to edit patient information, you cannot edit the patient's name, you cannot edit the patient's name, but you can edit the date of birth, the gender, the medical aid, and all this other information. Let's say that Julius, excuse me, prefers to use other language, that is not English. Let's say he prefers to use Afrikaans. And then we can notice that the patient doesn't, it says here, they don't have medical aid. Let's say they do have, it's just that they didn't mention it. This information is very important. If they do have a medical aid, you must edit this information. Let's say they do have an Anglo medical scheme. And once you've put on the name of the medical aid, you must as well put in the medical aid number. As you can see the asterisk here, it means this information here is very crucial. You must not skip it. Let's say this is the medical aid number for the training purposes as well. So the patient doesn't have an email address. This information is very much important because the facility might need to communicate with the patient for the vaccine purposes. Let's put on the email address. Say Julius. And the cell phone number, you confirm the cell phone number if it's correct. If it's not, you can edit, and the physical address, you can also confirm with the patient in front of you, and every other information. After you've done that, then you can click update patient information. You can see now the medical aid has been updated, the cell phone number has been updated, and we've also captured the email address that was not there. So now we're happy that information for Julius is now updated. Then we can confirm patient details by clicking on this button here. You can notice that after clicking this button, these other buttons are now activated. As before they were gray, but now they're now white and activated. So you can confirm all this other information here. Let's go and confirm the verified documents for the patient. So it's important for you as a patient administrator to confirm the identity documents that they brought in front of you. So you can confirm if it's not expired, it will say it's true. If you want to add another one, they say they didn't bring an ID book today. They brought another form of identity. So you can edit by clicking on this button here. After clicking on this button, you can choose which one they did bring to you today, whether it's a certificate or it's a passport or it's a foreign passport or it's a smart card or it's a driver's license. You can choose whichever one that they brought today. Let's say they brought the driver's license. And then the ID number on the driver's license is the same as a patient ID number. And then you can put on the expiry date for the driver's license. Okay, and then you can click on save. Please note that you cannot skip this step. Once you've chosen the form of identity that they brought to you, you cannot skip these two steps because of this asterisk here that shows that this information is very much crucial. You can click on the save button to continue. This will save the information that you just entered, and the identity that you just captured will appear here under the proof of identity. And you can see that it's still active, and the date of expiry as you have captured it, it's there. And then it was verified by you today. You can either save and exit if you were just checking on the patient information, but it's very much important that you continue to check every other information as a patient administrator. So you can also check the vaccination history of a patient. This will show you if the patient has been vaccinated before or they are coming for their second dose. It will appear here, the date and the reason why where they were vaccinated and the document that was presented on the day and the vaccination and the facility where they got vaccinated, and as well as the type and the actions. Under actions here, you can add any other information regarding the vaccination if the patient has been vaccinated before. You can also view the appointments that the patient may have with the facility. So we can see here that there was an appointment in March 3 for vaccination, and the time slot was at 2 to 4, and the status is still open because now the patient has not been vaccinated. And then the facility was at Chikang Mana Tabane Hospital. And you can also see the communication under emails, the communication between the facility and the patient about the patient vaccination. So this is where your journey ends as a patient administrator. After this, you can just go back to the search, or you can save the information and exit. But I want to draw you, let's save the information. This will take you back to the search button where you can search for another patient as well. But again, as a patient administrator, you can also click on the administrator where you can view your facility settings, as well as you can also click on the reporting. This will take you to the report where you can view the report and make reports for the facility. As a patient administrator, you are able to create reports for the facility where you're working at. Under view, you can see that there's no report in this facility that has been created, but you can just create the report for the facility by clicking on the reporting and then click on the vaccinations at the facility. We urge you that you do this every day to see the vaccinations of the facility on a daily basis, and also to check and balance your stats for vaccinations as well as your syringes. By clicking on the report, this will take you through to the report, to the creating of report. So here you can just select the date of the report, the date range, as well as the facility. Let's say we only want the report for today. And then you can either select the facility using the longer route, or you can just search for the facility here. Let's just search for the facility. And this is the facility we're working at today. We confirm it's correct. And then we can just generate the report by clicking on the Generate Report button. Excuse me. This will take you to this report that you've just generated. You can see the status here is still running. And it will give you the date that you've created the report, the facility name, and the date range. You can see that it's only the report for 1 day. And this is the report name, the vaccinations at facility report. And this is a facility report. You can now see the tick. It means that your report is now ready. You can click on the view button to view the report, or you can just delete the report. Let's just click on the view and see. This will give you the name of the facility, the province where the facility is at, and the district, and then the vaccine site as well. And currently now the vaccine site is closed, but now the total vaccination is 1. And if you've got more than 1 vaccination, it will show here on this report as well. You can just from here click on back to view reports, and you can just click on delete reports and delete this one. We can delete this one because it's just a training instance. This will delete the report, and we can just delete or cancel. If you are sure that we want to delete, we can delete. If you don't want to delete, we can just cancel. Again, as a patient administrator, you can edit your profile by clicking on Edit Profile. This will take you to your profile as a patient administrator. You check if all the information that was captured is still correct. Your patient, your names, as well as your surnames, your role as well, your ID. You check if you want to change or make edits, you can just edit and click on update personal details here. And again, if you click on this button here, on help button, it will take you straight to our help manual, to the EVDS manual. This user manual will assist you if you've got any other questions, or if you get stuck while using the system and you want to view or get some more information about the system. It's all in here in the user manual as well. And again, it's important when you are done using the system, you log out as a patient administrator and not allow anyone to use the system under your login details. If there is anyone who wants to use the system, they must log in using their own credential as well. Let's log out as patient administrators. Now, as the administrators is done with the patient will now move to the vaccinators. We'll have to log in as vaccinator. We continue when you log in as a vaccinator as well, you must continue to select the facility. It's important to link the facility with the device that you're working at. As you can see, it's not registered, even though the patient administrator was using it. So you select the facility, Helen Joseph. We can remember that at first we used the longer route, so now we're going to use the shorter route. And then you click on search. When you click on search, the facility name will appear here. So you confirm if this is a facility that you want, and then you click on it, and then you click on set facility. Then you have to confirm if the facility details are correct, or this is the correct facility that you're at. You can confirm this information by asking your colleagues around you if this is indeed the facility that you're working at today, so that you don't make any mistake and register the facility that you are not working at. If you want to choose another facility, you can click on this button and choose. It will take you back to set facility, and then you'll choose your facility. But now we continue and we set the vaccine site. Remember, after setting the facility, then you have to choose the vaccine site. Then we have to choose our vaccine site, and then we click on set vaccine site. Click on it. This will take us through to our search patient buttons. So as a vaccinator, again, you can either search a patient using this search button here, or you can use this search button here. This will take you to this button where you can either search for the person using the ID or using the number, or you can search again using the appointment date. So we search using the ID number because that's what we have for the patient today. The ID number, we put on the ID number, and then we click on search. The patient detail will appear at the bottom here, and then you'll have to confirm with the patient if he is indeed Julius Dial. And then if this is correct, and then you click on the patient information, you can click anywhere here. It will take you to the patient information. So as a vaccinator, again, it's important to check this information and confirm again against the identity that the patient brought to you. So you ask what is it that they brought, and then they'll show you the ID, they will show you the smart card, they'll show you the birth certificate, whatever identity that they brought. You can see again, these other buttons here are inactive or they are grayed out. You cannot click on them. So for them to open, you'll have to confirm if this information is correct. This again forces you not to continue until you've checked this information and the spelling and everything, if everything is correct. So you will check the full names, the date of birth, the gender, the ID number, the voucher, if it corresponds to the one the patient is bringing to you, the physical address, the email address, the phone number, if it's their phone number or is the friend's phone number or any family members, and the medical aid as well. And then you also see that the patient is eligible for 2 vaccines, eligible for J&J, is also eligible for Pfizer vaccine. So please make sure as a vaccinator that you check the vaccine that you have on your hand before you can say that, okay, today I'm vaccinating using Pfizer or I'm vaccinating using J&J. It must correspond with what you have on your hands. And then after you've confirmed all this information, you can just click on this button. That is to make sure that you've confirmed that the patient information is correct and the vaccine number is as presented to you. You click on the button. This will activate again this confirm patient details button. And then after you've confirmed as a vaccinator, it will open all these other buttons here where you can again confirm patient details. So you can just check the verified documents. You can see that they brought the driver's license today, as it was verified today, and it expires in October, which means it's still active. As you say, it says true here. You can add again as a patient vaccinator if you want to add another identity for the patient. But today we can see that there is one that is already added by the patient administrator. So if you see that everything is correct and you are happy, you can just click on register vaccination. You can just save as a patient vaccinator, but we urge you to please continue verifying all this other information here before you can click on register vaccination. So you can click on vaccination history. You can check on the vaccination history of the patient, as you can ask again the patient if they have been vaccinated before, and they can tell you, no, this is my first time, I haven't been vaccinated before. It's better if you check it for yourself and you see that, okay, it's still open, they haven't been vaccinated before. It means, yeah, everything they're saying is true. You confirm it, you don't take their word. And again, you can view appointments. As a vaccinator, you can see the appointments that was made before a long time ago in March, but it's still open. It means it was not used as the patient was not vaccinated. You can also see the patient communication here. Okay, after all this is done, as a patient vaccinator, you can now click on register vaccine, so that you vaccinate this patient, because every information that they brought to you, you've confirmed that it's correct. You can click on register vaccination. This will take you to this window. This is where you register the vaccination of the patient. You register the consent and you obtain the background information of the patient. If it happens that you are experiencing power outs or system downtown and you cannot capture on real time, you have to use the standardized official form for back capturing. And later, the back capturing administrator will take this standardized official form of back capturing, and they will capture the information as you've indicated it on the form. So please make sure that each and every information is there on the manual form is captured, and you don't skip any step. Because if you capture on the system, there are some steps where the system won't allow you to move to the next step without completing it. But when you're using the manual form, it's easy for you to skip other steps. So we urge you not to skip anything. You make sure that every bit of information is captured to make it easy for the back capturing administrator to capture information for the patient at a later stage. So if it happens that the back capturing administrator is capturing on the system, they'll have to click on this button here for back capturing later. And then they'll have to capture the date when the vaccination took place. And then they capture the time as it is indicated on the manual form, and the vaccinator that vaccinated the patient. Remember, the vaccinator is the person that logged in as a vaccinator on the system. It has to correspond with what's on the manual back capturing form. So as for today, we are doing this as live capturing or real-time capturing, if I may say so. So we'll have to inactivate this back capturing button here. So we won't have to change anything here on the time, and the time of vaccination is auto-populated because we are capturing it now. After you've done that, you have to obtain the health background of the patient. You'll have to ask the patient all this information, all these questions, they have to be answered. Otherwise, you won't be able to move to the next step. So for this sake, they say the patient is answering no to any of the patient. They are not sick. They haven't received any vaccines. They're not diagnosed with anything. It's a no, 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 no. For the sake of time, so that we move on. And if ever they answer yes to any of the questions, we'll see it will open some information. So you'll have to choose. If they say that they have any other chronic conditions, you'll have to choose those chronic conditions if you say yes. And then if it's not listed on the list here, you'll have to click on other, and then you'll specify whatever that it is that is not listed here. And then you'll have to, if it's a female, you'll have to ask if they suspect that they are pregnant today. If they say no, but they are not on family planning, you'll click on yes. And then if they don't know again, you'll also click on yes. And then you'll have to indicate when their last menstrual period were. You'll ask the patient and then they will tell you, and then you'll indicate here. But as for today, we know that Julius is a male. Julius can never be pregnant. So for male, it's not applicable. So we click on it's a male, and this question is not applicable. Okay, so considering all these answers that you've put in here as a vaccinator, do you think that the patient, do you want to proceed with vaccinating this patient? So you'd have to answer these questions as a vaccinator. So if you say no, it will take you to this window here where you have to state why you say no. Why is this patient not eligible for the vaccine? Why are you not vaccinating this patient? Then you'll have to state, and then you'll end the vaccination registration, and it will take you back to another patient. But as for today, we continue with the vaccination. So we're going to click yes. We continue. So we'll now have to record the informed consent for the patient. But before that, you'll have to check on your hand the vaccine that you have. Do you have the J&J vaccine, or do you have the Pfizer vaccine? So let's say we are vaccinating today. If I'm looking at what I have, I've got Pfizer vaccine. So I'm giving the Pfizer. So this will take me to this informed consent. I'll have to, as a vaccinator, you'll have to read all this information to the patient, and you make them understand what this means. You read it in a way that they understand, and you also explain it in a way that they understand what they are setting themselves to. And after you've read all this informed consent, you confirm that you have read and explained the above to the patient as it is needed. So you explain all these other big words that are here so that the patient understands what they mean and what they are setting themselves up to. And then let's click that they confirm. We confirm that we've read to the patient. And again, the patient must also agree that they understand and everything has been explained to them and they want to be vaccinated. So you must read all this information again to the patient in a way that they understand again. And then after that, if they do consent to being vaccinated, after you've read the consent to them as well, because they don't have access to the paper consent, then you can click yes, or if they don't want to continue, then you can click no and you end it here. So note that you cannot move on again without answering these two questions. Let's say they agreed to be vaccinated today, we click on yes. So this takes us out to the confirmation of the vaccination registration. So now, from here, you must make sure that you take your vaccine, you administer to the patient before you can click that you confirm that the vaccine has been administered to the patient. You don't assume, okay, because we've read the informed consent, they agreed, so I can just put that they've vaccinated. So you put the vaccine first. You administer the vaccine first. So after that, then you can check the identity that they brought. We can see that today they brought the license. And then if it's not on the list here, you can click on add. This will take you to the button where you can add again. And then you can confirm if it's the vaccine dose, which is the first dose, yes. And then remember that we chose Pfizer. It will appear here that yes, it is Pfizer that we have administered to the patient. And then the batch number, you can choose the batch number and then you make sure that you put in the batch number. This is very much important. The vaccine serial number, again, you can just put in the vaccine serial number. It's very important, even though there's no asterisk here, but please put all the information as needed. Don't skip any other information. And then you put in the vaccine expiry date. We can see that it expires in the end of August. And the vaccine manufacturing date, you can also put the vaccine manufacturing date as it appears on the vaccine. After you've done all this and you confirm that every bit of information here is correct, as a vaccinator, you can now register vaccination because we now know that we've administered the vaccine into the patient's arm. Click on register vaccination. This will take you to this window again to confirm that you've successfully captured the vaccine information, and then it will state that the vaccine requires more than one vaccination dose to be effective. This again will alert you that you've administered a 2-dose vaccine, which is not J&J. If it happens that you see on your hand, you've got a J&J syringe lying around, but here it says a 2-dose vaccine, it means you've done the wrong thing. So it will tell you the next vaccination is estimated to be on this vaccinating date, as provided below, and an SMS will be sent provided the cell phone number to confirm the second dose appointment. So if the cell phone number that was provided is not for the patient, it means the patient must keep in touch with the owner of the phone to make sure they get their messages. And also there will be a vaccination number, the vaccination date, as well as the patient name, the ID, the date of birth, the cell phone number, as well as the physical address. So if you see that every information is correct, then you can click finish, and then it will take you back to search for another patient or for you to assist another patient again. So as a patient vaccinator again, you can also click on the administration. This will allow you to change the facility or set the facility. Again, if you click on your login details, you can edit your profile as the patient administrator does. And again, you can click on the help button to get the user manual. And most importantly, you log out of the system when you are done working on the system. You do not leave the system unattended and with your login details, because anyone can come and work on the system. So please make sure you log out of the system. This takes us to the end of our demo for today. And again, what I need to draw your attention to, colleagues, you can also go to his support if you need more information. You can go to his support .health.gov.za. This will take you to this screen here where you'll have all your training materials listed on the system. So the EVDS ecosystem, EVDS users training and materials, this is where you'll get all the information. You'll get the account approver training, the account creator training, the MFL facilitator and creator training, as well as the patient administrator and vaccinator training material for on-site EVDS, which is what you are doing today. If you click on this button here, it will take you through all the training material as well as the videos that will assist you when you get stuck or when you need help. as well as you'll get your quick reference guides, you'll get your cheat sheets as well as the training support material and the PowerPoint presentation that we're using today, ladies and gentlemen. This takes us to the end of our demo for today. I would like to hand things over to you, Raleigh, to continue. Thank you very much for your time.
Thank you, Mabaya. If I could actually ask Mbeki to post the quiz link in the chat, we can then move over to that one, just so that we can finish the quiz before time runs out. And then colleagues, you can then just complete the quiz. Mbeki, over to you.
Good afternoon, colleagues. My name is Mbeki Lobo. I'd like to take us through the quiz. It's a short quiz. We have 6 questions. It's multiple choice, and the responses are going to be anonymous. We won't be able to say so and so got what, but we'll be able to see how the group performed. So I've posted the link on the chat to this meeting. May I request that you select that link, follow the link, and then you can answer those 6 questions, and then we can. It will sort of we're doing this in order for us to have an understanding of how much people understood the concepts and the processes that we are explaining. It also helps us to train better when we arrange future trainings. So it will be very helpful for both of us, the facilitators of the training as well as the participants. So I'm going to, okay, let me try to share my screen and check. We have more than 50. I think we had more than 60 people, so I expect to see more replies. So I'm going to go to the quiz. So the first question is there, but we have 2 responses so far. I'm just going to give us maybe another 60 seconds for people to quickly answer. As you can see, it's a very quick quiz.
Actually,
Yes, I was training today.
yes, I was presenting, so sorry, ma'am.
Oh, no worries. Sorry.
We have 4 responses. At least we should have a minimum of 10 before I can proceed, colleagues. Can we try to complete some more? I need more responses before I can start reviewing them. Let's go. And
Mbeki, they're just saying it's not opening, so perhaps if you just resend the link, perhaps it can.
okay, let me resend again. Just one more. I've just sent another one, but I think we now have more than 10. Or we still have 8. Okay, I think I'll proceed with 8. I would have wanted more. So what was the responses, the feedback on the responses? Now 9 responses. Okay, our first question was, how can you request help? So out of 10 people that responded here, we can see that there were 10 correct responses. It's 100%, quite impressive. Next question was, as vaccinator, do you have to verify the vaccinee ID? 10 out of 10 responses correct, so we got 100%. Next question was, can you add an identity document on EVDS? And here we have 7 people out of 10 getting this one correct. So the correct answer is yes, you can add an identity document on the EVDS. The next question is, do you have to capture the vaccination serial number on the system as best practice? And everybody got it correct. We have 100%, and the answer is yes. Next question was, can you save your password on the web browser? As best practice, the answer is no. So the people that are saying yes, I'm sure the understanding is that in order to strengthen the security and to avoid unauthorized access, we should not save passwords onto the web browser. The next question was, which of these are components of the EVDS ecosystem? So 12 out of 14 correct responses, which is good. That's 85%. So we have 4 components. It's the enrollment and scheduling, the MFL, the data analytics, and the on-site EVDS. That is actually our last question. So to a large extent, I'm impressed by the people that responded. We're getting lots of 100%, which is a very good thing. So I think at this point, I might as well share the link for the evaluation. What's happening here? Okay, the evaluation. Let me just get the link for the evaluation. Okay, the training evaluation link is here. And with this evaluation, I'm going to request that all of you colleagues, you use some time to respond to this evaluation. It's possible to do it now, but it's also possible to do it even after we end this this session. So with the evaluation, we also aim to gather feedback from you as participants, and it also helps us to be more effective in terms of the delivery of our training. You can give us feedback there, and we will use it to further improve on our training delivery. So if you could also use some time to follow the link for training evaluation and give us feedback. I think that should sum it up for the training evaluation and the quiz as well. Riley?
Thank you. Thank you for that, Becky. Just to confirm, you can all see my screen, correct?
Yes.
No problem. I'm putting it in presentation mode. There we go. So colleagues, as we mentioned earlier on, is that we do have a post-training material that will be available to you, and Mabaya had also showed you where to access it, but also if you have forgotten it, that's not okay. We've also embedded the link into this slide. So some of the post-training material that you'll find is the cheat sheet. So we've created a cheat sheet for the patient administrator and vaccinator roles, and this will just help you deal with some of your day-to-day functions. It provides you with an overview of the EVDS, as well as a high-level view of the process that you would be following in your specific role. we've also created quick reference guides for all the EVDS users. So this includes account creators, account approvers, vaccinators, and patient administrators. And what the quick reference guide is meant to do, it provides you with a visual aid and that kind of walks you through the entire EVDS process for your specific role as the patient administrator or vaccinator. The quick reference guides, as well as the training clips as well, are actually very much action oriented. And again, speaking to the training clips, these are short videos. I think the longest one is 2 minutes that will kind of provide you with a guidance on how to use the EVDS on-site system in of itself. And it also, again, to speak to both the quick reference guide and the training clips, is that both these two forms of material are very much action oriented. So they speak to either you wanting to record the vaccination, you searching for a patient, you trying to pull reports, or you trying to link your device to another facility, right? We also have the FAQs as well as the have you tried, and these are just trying to answer general commonly asked questions and tips on how to use the EVDS as well. And also, more importantly, to kind of just empower you to be able to self-resolve some of the issues that may arise before having to log a ticket with the service desk. We do, as you can see here, all of this material will be available on his support site. You can just follow this link. And again, this information will be sent to you afterwards. And then looking at the have you tried, this is where we just want to take you through some of the quick troubleshoot steps that you can take before wanting to log or contact the service desk. So in the event that you are struggling to log in, you can first see whether or not your account has been activated by following the link that you would have received in your email, right? Try to also reset your password through the forgot password. And then also try and see if you have cleared the cache on your machine by accessing the settings on your web browser, specifically the Chrome one. So sometimes you might find that you're struggling to log in, or the system is a bit slower because of the cache, or that's kind of filled up. So you can just clear that. And then if you are unsure on what to do next, again, before even contacting the service desk, just try looking at the user manual that's accessible through the help button, or also refer to the training materials. May that be the cheat sheet, the quick reference guide, the training clips as well. And then also some of the things you need to keep an eye out for. And these are things that we're just trying to re-emphasize, is that you need to make sure that your device is actually recorded at the correct vaccination site, right? And when leaving your workstation, like Mabaya had mentioned, remember to make sure that you log out of the EVDS. And this also is relevant for when you are simply just taking a lunch break, or stepping out of the room, or stepping away from your workstation for a while. Please make sure that you log out, and keep your EVDS password a secret, please. Do not share it with anyone else, or even save it on the web browser, understanding that somebody else could be using that device as well. And don't allow unauthorized users to work on the EVDS. And this also links to making sure that all patient information is actually kept confidential. And again, one that's very important is only register the vaccination on the EVDS after you have administered the vaccine to the patient. And as Mbeki has already shared the link to the training evaluation, so please do follow that link and complete it, so that we can gain more insights and find better ways to improve the sessions as well. And then lastly, are there any other questions, colleagues, or comments? if there aren't any questions or comments, colleagues, from my side and you know, on behalf of the team as well, Mbeki, Mabaya and Tembagazi, I think we just like to say thank you for attending the session and taking the time to go through this entire session. I am aware that we even went 10 minutes over time, but thank you again for your patience and your willingness to engage with us on the session. And if there's nothing else, all the best, and we will send the training material as well as the video or the recording of this session later on today. Thank you, everyone.
Thank you.